Well, thank you. Hello, everyone. Thanks for inviting me here today. I'm going to talk to you about our initiative, which we're calling OHARA, for a One Health approach to risk assessment in Canada. And I should just mention that we are a fairly new center at FAC, so we've undergone a recent name change. I didn't get that into the introduction there, but we're now the Center for Surveillance, Integrated Insights, and Risk Assessment. So I'll start by providing a little bit of background for you, and then I'll go into talking about One Health scope and risk assessment scope, which are both very complex issues. And then I'll talk about our OHARA initiative in particular, and a little bit about our environmental focus session that we held recently. I'll talk about a few high-level lessons learned and then some next steps. So starting with the background, Canada, just like many other countries in the world, needs the capability for early detection, understanding, and action to address emerging human, animal, and environmental health threats. There's been a lot of work recently on identifying threats, but we also need to assess them in order to enable prompt and effective action. So it's not enough just to have the identification, we also need the assessment piece. There have been a number of international activities on One Health in the last few years, and so just some of the ones that have been particularly helpful from a risk assessment perspective. In 2020, the tripartite, which at that point was the World Health Organization, the World Organization for Animal Health, and the Food and Agriculture Organization, they released a joint risk assessment operational tool, which is a really handy tool. There's also been, as many may know, a One Health high-level expert panel that was put together. They've done many things, but one of which is defining One Health. And in 2022, the tripartite officially became the quadripartite with the addition of the United Nations Environment Program. And then more recently, this quadripartite released a One Health Joint Plan of Action. This Joint Plan of Action has 6 different action tracks. So there's, for example, one related to emerging and re-emerging zoonoses, one related to neglected tropical and vector-borne diseases, food safety risks, AMR, but they also have one action track that's specifically related to integrating the environment into One Health. And I also wanted to highlight that within the Joint Plan of Action, they call for harmonized protocols and normative standards for One Health risk assessment. So this is basically what we're trying to do with this initiative. We're facing several challenges related to multi-sectoral risk assessment. And so first, there's a lack of federal leadership for multi-sectoral risk assessments in general, resulting in silos. And it's not just silos between sectors, but also silos between disciplines. So for example, there may be multi-sectoral work happening related to food safety, but it tends to be siloed from the work related to non-enteric zoonotic diseases, which tends to be siloed from work related to climate change, et cetera, et cetera. Second, we do have some collaborative mechanisms, but they tend to be relatively slow mechanisms that don't necessarily allow for joint analysis and timely analysis in an emerging situation. We know that One Health includes multifaceted risks with high uncertainty. And so this really requires complex risk assessment methods and inputs from multiple sectors. There's a lack of ongoing capacity for risk assessment, not everywhere, but in some topic areas, and definitely at the sectoral interface. And then finally, there's challenges related to different mandates and different priorities and topics that don't necessarily sit clearly within one sector. So now I'll switch to discussing One Health scope and risk assessment scope. And so, as I mentioned, the One Health high-level expert panel, they recently released this definition of One Health. And it may seem fairly simple, the idea of coming up with a definition, but I think it's rather complicated in this case. And I think it's a really great thing that they've been able to put out. And so they define One Health as an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. And they mention the need to tackle threats not only to health, but also to ecosystems. And so one of the important things about this definition is that it has an ecocentric perspective. And this chart or diagram here describes different perspectives. And so an anthropocentric, it's hard to say, perspective, it sees the intrinsic value mainly of humans. And so although with that perspective, you might be looking at the environment or animal health, but always trying to tie it back to its value to humans, as opposed to an ecocentric perspective, which sees all living beings and non-living things in nature as having their own intrinsic value. And while we're talking about perspectives, it's important to recognize that something can be seen as a central unwanted event from one perspective, but instead be seen as a driver or an impact from another perspective. And this is something that it's important to recognize when we're talking together across sectors about risks. And this can be illustrated using risk bow tie diagrams. If you haven't seen one before, they essentially have a central adverse event. And so this is sort of the combination of the hazard and the event with causes or drivers on the left-hand side and consequences on the right-hand side. And so one example is that one group may be seeing zoonotic diseases as the central adverse event, with a list of causes or drivers that might include loss of biodiversity, for example, or climate change. While another group may be seeing these, the loss of biodiversity or climate change, as their own central adverse events, and they're looking at the risk of those events, and they have their own list of causes and consequences. So it's just important to recognize these differences in perspective. Risk bow tie diagrams can also help us in illustrating that there are different ways that risks may be at the intersection between sectors. So we talk often about the intersection between human, animal, and environmental health. And the bow tie in the center there, I think, is a much more obvious situation, or it's kind of an obviously intrasectoral situation where you have drivers and impacts that are involving multiple sectors and multiple sectors' mandates. And the X's on the diagram there, they represent barriers such as mitigating measures or control measures along the pathways, and maybe these involve multiple sectors as well. But there are other situations that are maybe less obvious or more challenging. You can have a situation like the one on the top bow tie there, where the drivers are mostly falling within one sector's mandate, but the impacts are mostly falling in a different sector's mandate. And this can be challenging because the sector that is really feeling the impacts, they may not have control over the mitigating measures, or they may not have the information to assess the likelihood of the event. Whereas the sector that is experiencing, or that has control over the mitigating measures, They may not necessarily see the importance because they're not, or the impacts aren't necessarily falling within their mandate. And then you can also have situations like the one on the bottom there, where the drivers and the short-term impacts all fall within a sector, and it seems like an intersectoral issue. But then when you start looking at longer term impacts, so maybe this is an animal disease issue, but when you look at the longer term impacts like food security, you realize that these are affecting other sectors. And so it really becomes a multi-sectoral issue. And so with a range of perspectives, it really comes a broad scope. And so One Health, it equals multiple types of hazards. So biological hazards, environmental hazards, chemical or radiological hazards, meteorological or hydrological hazards. And all of these hazards are occurring in complex systems. The broad scope is starting to be seen and recognized at the international level as well. So I just wanted to include here, this is an event that happened recently in October in Berlin. It was called Breaking Barriers, or Advancing the One Health Agenda with a Focus on the Environment. And I found this little blurb here on LinkedIn where they talk about the scope of the discussions. And so they were talking about issues of pollution, soil health, forest health, management of invasive alien species. And they mentioned that One Health is so much more than zoonoses and AMR. And so I think it's important to follow this lead and look at that broader scope of One Health. And just to further broaden the scope of our initiative, there are also many types of scientific assessment that are applicable to One Health. And so the line between risk assessment and other types of scientific assessment can be blurry, especially when you're discussing the methods that are used in different sectors. So many of these methods have a risk component, or they're meant to understand different aspects of risk, even if they don't necessarily fit a formal definition of risk assessment. And the different issues in One Health, they might require very different types of assessment. So all of them could be important at different times. And one of the things that we've done is to categorize them a little bit in relation to either their objectives and whether they're acute objectives or strategic objectives, and the scope in terms of whether the scope of the assessment is hazard or product specific versus those that are more multi-hazard. And so we've been talking a lot about defining risk assessment. There's the risk analysis triad, which includes risk assessment, risk management, and risk communication. We've been working on a lexicon, and so the different sectors and different disciplines follow different international standards. These standards have definitions. So for example, there's different definitions of risk assessment. And so we've pulled these definitions all together and are looking at some cross-cutting principles behind the definitions. And so for risk assessment, a basic cross-cutting principle seems to be that it's a formal process of measuring the likelihood and impact of an event. And so there's that more formal definition. And then, as I mentioned, there's the other risk science products that can also be useful. And then one thing that we've defined is the difference between what we would call a One Health risk assessment, which would be a more balanced look at impacts across sectors. But you can also have what we're calling multi-sectoral risk assessments. And so these might impact primarily one sector, or be looking at the impacts primarily to one sector, but you still need input from multiple sectors, or perhaps the actions that are come out of the risk assessment need multiple sectors. And so it's still important to have a multi-sectoral approach. And so we would basically consider both of these to be useful in different circumstances. They both are essentially taking a One Health approach, though only one we would call a full One Health risk assessment. So I'll provide a little bit of an overview now of our OHARA initiative. We've started with 3 main objectives for the initiative, though there may be more as time goes on. The first is to develop a protocol. We're actually in debates right now about whether the best term is protocol, or if it's more like a framework or more like guidance. But essentially it's going to be a document, and the idea is to make it publicly available to operationalize a One Health approach to risk assessment in Canada. A second objective is to try to build capacity through training. And then third, to develop or adapt various risk assessment methods and tools for a One Health context. What we've learned through our consultations to date is that there are many existing multi-sectoral risk assessment activities, and we don't want to reinvent the wheel or duplicate this existing work. So a big part of this initiative is to link existing risk assessment activities using a federated approach to improve communication, collaboration, coordination, and capacity building, but then also to develop new multi-sectoral risk assessment activities where there are gaps, for example, for emerging issues. Although FAC is leading the development of an overall framework for a One Health approach, within this, single risk assessments would be led by individual sectors with participation from other sectors. And there's guidance on how to determine which sector would be the best lead, whether it be based on mandates or capacities. And then we also have guidance on what to do if there's no clear lead, and how to escalate that issue to try to find a lead, or just to make sure that the issue doesn't get just dropped. And so some of the expected outcomes from this initiative is that we hope that leadership and other roles and responsibilities will be clearly defined, that there will be a sustainable mechanism for multi-sectoral risk assessment, knowledge of cross-cutting risk assessment principles, that people will have the appropriate methods and tools available to them when they need them, that the environmental perspective will be incorporated, that there will be networks and a process for engaging experts to gather the intelligence quickly and efficiently, and to be able to use this to assess risk. And that by engaging multiple sectors early in the process, that there will be engagement in the risk management measures that result from risk assessments. And then overall impact, we hope, will be a better understanding of risks to enable more prompt and effective action for health security. In terms of what this protocol or framework or guidance, whatever we end up calling it, will look like, the first piece of it will be a foundation. So really talking about some of the scope that I've talked about already, the different sectors' perspectives on risk and risk assessment, and some guiding principles. There will be a section on the people, so clarifying roles and responsibilities, a section on the system, and so we've offered some generic operating procedures, for example, for triggers for initiation, determining risk questions, choosing the appropriate method. We have a section on the information, and so that's really discussing types and sources of information and best practices for information sharing. And then there's a section on implementation considerations. And these implementation considerations will include things like the need for a scientific secretariat that would lead strategic activities, things like maintenance of a network, an ongoing network, ongoing development of methods, training, reevaluating. And we feel that without a scientific secretariat, this work won't necessarily continue. In the short term, the protocol uses existing governance mechanisms where available. So, for example, it suggests issue-specific and ad hoc steering committees and using existing networks or existing committees where they're available. In the longer term, though, we know that various groups are working on One Health coordination mechanisms on a larger scale, and so we expect that the OHARA protocol/framework will link well with these other mechanisms. We've had to do a lot of consultation for this initiative to date, so we have a multi-agency technical advisory committee that's been meeting since October of 2022. We've had a technical session on methods and tools, an international workshop, and then more recently an environmental focus session. And displayed on this slide is just a few, well, most of the examples, but not all of the different organizations that have provided input to date. We've been doing a number of technical activities as well. So we did a literature scan that looked at different methods and tools used in the different sectors, as well as best practices for multi-sectoral risk assessment. We've been working on this lexicon that I mentioned, where we identified key terms as a group, and then we've been gathering the different definitions from the standards that are used by the different sectors, and we had people on our advisory committee help input into that. And then we've been looking at determining the cross-cutting principles behind those different definitions. And then we've done a survey on risk assessment activities and roles and responsibilities. And I wanted to spend a little bit of time reviewing some of the key preliminary findings from our environmental focus session. The purpose of the session was to engage environmental experts to develop a shared understanding of the environmental landscape of risk assessments. This was a reasonably short session, so just an hour with 24 attendees, and we did recognize that it was weighted towards wildlife health. Throughout the planning process, we were starting to try to expand the participation, and we realized that it was just such a large area, environmental health, and we didn't have all of the proper connections, and that more work would need to be done in that area. And so we just went ahead with this shorter session to have some initial discussions. And so we had breakout sessions, and we asked three main questions. The first was, what environment-specific considerations should inform a One Health approach? What already exists in environmental risk assessment that we need to be aware of, and what are the gaps? And then what is your further advice as we go forward? So related to the first question, there was a lot of discussion about the need for a broad definition of the environment. And so not just looking at the natural environment, but also the built environment. There was discussion of the difference between the environment and context. So, for example, the social political environment. There was discussion of many different ways that the environment is incorporated into risk assessments. So there can be environmental hazards, for example, environmental drivers of risk, or environmental risk factors. There's also environmental consequences, but not just consequences of the hazards, but also consequences of the risk management measures, as well as different environmental monitoring points. There was discussion of the high rate of environmental change. So for example, climate change and changes in land use, and how this affects risk assessment and poses a challenge for risk assessment. Other challenges were related to priorities that are focused on shorter term impacts, as well as siloed mandates. And there was discussion of sociocultural considerations and the importance of them, as well as risk communication. Related to the second question, so we did recognize that only a selection of the environmental sector were represented at the meeting, but we still found that there were many examples provided of structured formal environmental risk assessments with advanced methods, though not too many people at the meeting said that they were actually conducting multi-sectoral risk assessment. But some of the examples of risk assessment activities that were provided were related to plant protection, biotechnology safety assessments, aquatic assessments, infectious disease risk assessments, and invasive species assessments. A number of gaps and challenges were identified, including evidence gaps such as lack of data or tools to collect data, or a lack of rigor in the evidence, the need for research on the link between the environment and diseases, as well as the need to know what data is actually necessary to affect change. So to help with focused data collection, acknowledging that there can sometimes be too much data and the need to focus that a little bit more. There were some methodological gaps identified, either due to siloed working or the need to have more connection between public health and wildlife health related to the public health risks associated with handling wildlife, the need for a connection between risk assessment and risk management, and the need to incorporate Indigenous knowledge. And many examples were provided for methods of how to do this at the meeting, which was great. Related to the third question on advice for us as we go forward, there was the need to clearly define One Health, and it was mentioned that scenarios or examples would certainly help with this. There's a need for strong networks for knowing who the specialists are in those networks before you need them in an urgent situation, for leveraging existing networks, as well as consulting more broadly in environmental health. And the participants mentioned that it would be helpful to have accessible tools, templates, and guidance. And there's also discussion of the need to have methods that balance group size with the need for various expertise and perspectives. So it's very important to have lots of expertise around the table, but also large group sizes can sometimes be unmanageable and result in not very good conversations and sharing of expertise. So there's different methods to help handle that and to balance that. And it was identified that there's a need for not just training in a One Health approach to risk assessment, but also that other sectors would really like to have training in the methods used by formal environmental risk assessments. And so the conclusions, preliminary conclusions from this session is that we need to expand the scope of risk assessments to create connections and to share knowledge across the different sectors and disciplines, to address a wide range of environmental hazards comprehensively and to tackle risks holistically. to break down silos and create connections to avoid duplicating efforts, and to learn from each other. And there's a need for methods that consider indirect and longer term impacts, such as those that are ecological, economic, and cultural. There's a need to integrate diverse knowledge systems, such as Indigenous knowledge, and the need for broader participation from different areas of the environment sector. And I'll take a brief moment just to review some of the big lessons learned in this initiative so far. First, we found that Canadian and international partners have shown a lot of enthusiasm and support for this initiative, so we feel this really demonstrates the need for this work. We found that many groups in each sector are conducting different types of risk assessment, so there's a large variety of methods and tools that are used depending on the risk question. A One Health approach, it really needs risk assessment, a One Health approach to risk assessment, it really needs the flexibility in roles and responsibilities to handle hazards that have a fuzzy alignment to departmental mandates. One of the key processes that we felt was really important is that when an issue arises, a multi-sectoral steering committee can scope or frame the risk and determine needs for analysis. And so this scoping and framing of the risk is such a key, important first step that really sets the tone for the rest of the work. And doing that in a multi-sectoral way is important. We found that, as I mentioned, the One Health approach can be used either to provide a One Health lens to sector-specific risk assessments, or to conduct full One Health risk assessments. And then some of the methodological gaps that have been identified throughout this consultation include environmental considerations. Companion animals were identified as a bit of a gap, especially in the government sector. Mental health and welfare as a gap. Non-infectious threats, although not necessarily a gap everywhere, it was identified as a gap within the One Health approach. And the need for methods to address long-term and cumulative impacts. And so finally, I just wanted to provide you with an idea of our next steps for this initiative. We have a draft protocol, and that has been reviewed by our advisory committee over October and November. And the goal is to present a high level of this protocol to Deputy Ministers Committee on One Health in early 2024. And so this is a federal multi-agency Deputy Ministers Committee. I believe there's something like 13 different federal agencies represented on this committee, so it's a good One Health venue. And activities moving forward, we want to work on endorsement of and engagement of this approach, to strengthen the link to certain sectors, to continue to advance methods. We want to develop an ongoing network. Our advisory committee is time limited, but we want to see this work continue so that we have some sort of ongoing network. We need to work on training, and then there's many different potential future activities. So for example, providing methods inventory, doing a mapping of functional areas, or looking at some of the gaps related to MOUs or formal agreements. So lots of work ahead of us. And I'll stop there. Thank you very much for your attention, and happy to answer any questions.